Rosamund. So what are the simple public health actions that employers can put in place to protect their employees or their business partners?
Sure, Alexandra. So in the first instance, the public health actions that the employer can put in place are the same as for everyone else. The number one action is hand washing. This can be done with soap and water, and it can be done with hand sanitizers, alcohol-based hand rubs. To do that as often as possible, certainly before eating, before or after handling maybe door handles or elevator buttons, things that are touched frequently by other people, especially during the winter months in the Northern Hemisphere or likewise in other parts of the world. It is from these frequently touched places that people can acquire viral infections. So it's really important to wash your hands, but equally important not to touch your face afterwards. Before, when your hands may be dirty, so what people don't realize how often. It may be that we are using too many masks because who really needs the mask is the health workers, the nurses and doctors who are treating people in hospital. So we recommend that you use a mask if you're already sick or if you're looking after someone who's sick. But otherwise, we're not recommending masks in a general sense.
Thank you very much. We also meanwhile received a question on masks. If you can just clarify as well, not when traveling, but in the workplace, that maybe community is affected by COVID-19. Do you still recommend that employees should all wear masks or not?
Now remember that COVID-19 is one type of infectious virus. There are others. There are common cold viruses, we could name a few, there's the flu season. These are all infections that spread in a similar way through the mechanisms that we've already talked about. So it's important if someone does actually have symptoms, whether they have a cough or fever or a runny nose, that ideally they would just stay home. If they're not that sick, you could offer that they telework from home. Ideally, they would not be in the workplace where they can infect others. If they are in the workplace, then again, if someone is actually having these kind of respiratory symptoms, we would suggest that that person who's not well is the one who's wearing the mask, not everyone else. And there's another reason for that, is that we've seen that when people wear masks, it's unusual, it's uncomfortable, it's not something they're used to, and in fact, you may be ending up touching your face more often than without wearing one. So you maybe want to adjust it, and then of course, by the time your mask become damp, in fact, that mask can spread the infection even more easily, especially if it's not put on properly, removed properly, disposed of properly in a closed bin. So we don't want to cause greater risk by everyone wearing masks for long periods of time. So if you are going to use one, then please do check what is the right way to wear and the right to dispose of it.
Thank you very much. This was a really great explanation. We are getting more and more questions, and here is one from Laura Patricia Lopez Meneses. Are there any special recommendations for from airports?
Well, very good question. So an airport is a workplace like any other, and again, it's about risk. So what is the risk in your workplace, in your community, and clearly an airport or train station may be a place where more people are passing. Now, if you're just passing someone, if it's not that crowded or you're not that close, just passing someone in a shopping mall or in an airport is not something that's going to increase your risk.